Hello everyone, I'm Dr. Akhil Tawari, consultant spine surgeon, and today I'll be discussing about a very common condition which is called as lumbar canal stenosis. Now, in order to understand what is lumbar canal stenosis, let me give you an example of a highway. So when we have a highway or a freeway, that is what our spinal cord is. And imagine that we have the exits or the side roads from where the traffic comes inside and goes outside. This same situation is in the spinal body. So we have the main highway, which is the spinal cord and the dura, and then we have the small nerves which exit at multiple levels from the spinal cord. Now, because of any reason in the lumbar spine, if there is compression of either the main highway or the smaller nerves, then the signals that are to be transmitted will get hampered, and that is what leads to a condition which is called as spinal canal stenosis. So as we know, either the stenosis can be in the center of the lumbar spine or it can be on the sides or the exits of the lumbar spine. Now it is usually seen as the age of the patient increases. So with an incidence of around 20 to 30% beyond 50 years, the incidence of lumbar spinal stenosis can rapidly rise to more than 50% beyond 60 years of age. So how does the patient present to us? So the patients of lumbar spinal stenosis, they present to us and they say very classically that whenever they try to get up, stand and walk, they are able to walk initially, but after a fixed distance, which may be 5 minutes, 10 minutes, or a distance of around 100 or 200 meters, that's when they start feeling that their legs are getting numb, the legs feel heavier, there is some paresthesias or burning sensations in the legs, and that's the time wherein they have to stop. Once they are able to stop for 5 to 10 minutes or sit, that's when the symptoms vanish, and then they are again able to walk for a further 5 to 10 minutes. This is an extremely classical way of the patients presenting to us. We call this condition as claudication. Claudication can again be of two types. Either it can be due to spine, which is called as neurogenic claudication, or it can be because of blood flow problem, that is the vascular claudication. Nevertheless, whenever the patient of claudication present to us, we make that distinction and accordingly take the management of the patient forward. Apart from this, the patient would also sometimes present to us with some cramping or associated back pain. Also, the patients were present with slight imbalance while walking. So on examination of the patients, we like to do a thorough neurological exam, and we routinely like to investigate the patients further. The investigation of choice starting from an X-ray, and we move forward and get an MRI scan. MRI usually tells us what is the status of the disc, what are the soft tissue structures, if at all, that are pushing on dura or the spinal nerves, and based on that we are able to come to a diagnosis. Now, initially the treatment for any patient who is presenting with spinal canal stenosis is conservative management. More than 50 to 60% of the patients get better with routine medicines, change in their lifestyle, as well as a short course of physiotherapy. A minority of patients, however, do not get better. And the important point to note is that their walking distance, that is the time interval between walks and stopping, gradually keeps on reducing. In such a scenario, we then would like to offer the patients intervention. The intervention can either be injections in the spine, though they are not as effective in spinal stenosis when compared with lumbar disc per se. However, they can be tried. Or else we like to offer surgery in the form of decompression. The exact approach, nature and the extent of the surgery depends upon the MRI findings and the patient's problem. We can tackle this in multiple ways. We can do minimally invasive surgery, which is now going forward is the standard of care, or we can also do the traditional open surgeries to relieve the pressure on the spinal nerves. The good thing is majority of the patients, irrespective of the intervention, do very well and they are able to get back to their routine levels of activities. Lumbar canal stenosis, I would say, is although a very common problem, it can become very disabling for the patient if the walking distance or the timing significantly reduces. If you are facing any such issues, I would recommend to get in touch.